Implantation spotting can be one of the first signs of a pregnancy. If you are trying to get pregnant in your 2-week wait, or if you are worried that you are pregnant, these are some things to look out for so you can determine whether it's implantation spotting or if it could be your period. So implantation spotting is generally only 1 to 2 days, 3 days maximum. That is backwards. Whereas your period is around 3 to 7 days long. Also, implantation spotting is very light. You probably don't need more than like maybe a panty liner. Generally, you'll just see it like a little bit on your underwear or if you wipe, and your period's gonna be heavier. So implantation spotting also doesn't have any clots. So there's no clots and it's light. Whereas your period is heavier typically what you usually get, and also it can have clots. Implantation spotting generally is pink. It can be mixed with other fluids, giving that light pink appearance. It can be red as well, and it can be brown. Whereas your period, it tends to be heavier, so then it can be darker blood as well. Obviously, you can get some spotting prior to your period, which can be brown or pink, but the main difference between implantation spotting is that it's not going to progress. So you're gonna get that 1 or 2 days, maybe 3, generally just 1 or 2, and then it stops and you don't get anything. Whereas your period's gonna progress into that heavier flow. You also won't really notice much pain with these implantation spottings. So you can get some cramping for sure, but you don't see like high amounts of pain like your typical period pain. Also, one of the main signs of implantation bleeding is the fact that you see it at least 5 days after your ovulation. So if you're tracking ovulation, you will notice it 5 days minimum. Generally, it's like between day 8 and 10. It's kind of hard to tell because most people do not track their ovulation. If you want to learn how to track that, I have many videos on it. The earliest you're going to see implantation spotting is 5 days, and then generally 6, 8 to 10 days, you'll kind of see it within that range. Whereas your period, you're not going to notice your period until roughly around 12 to 14 days after ovulation. That's a typical luteal phase. You can get your period a bit sooner or a little bit later, but typically your implantation spotting is going to be earlier than your expected period.